Health perspective. Well, we'll talk about our health from our perspective. I'm your host, Millicent Duncan.
And I'm the co-host, Brian Duncan.
Episode four?
Four. This is our fourth one.
Fourth one.
Yes.
We're still learning. It's a work in progress, but we're still learning. But that's what the whole purpose is, to bring information to the community. Okay?
That's right.
So this month is June. Is Alzheimer's and Dementia Awareness Month.
Okay.
We have a guest. I have a guest speaker.
Our first guest.
I have a first guest. I'm excited.
Yeah.
I want to go over some things about Alzheimer's and dementia.
Okay.
But there are different types of dementias. So you have Alzheimer's, you have vascular, and then you have several other. Alzheimer's accounts for 60 to 80% of all dementias. And then you also have dementias that occur due to a vascular event. Okay?
All right, got it.
But we're going to approach it from the aspect of caregivers.
Okay.
I think, everybody just automatically assumes, somebody in the family will come along and help. Which, as a family member, you love your family, but individuals don't realize how much of a task or a toll that is on the family. Like, I can recall when my dad had several strokes. How can I say it? The toll that I saw or the mental toll that I saw that it took on my mom. Hospitals, him not being, I'm not going to say he wasn't compliant. He had his times, and it also took away from the person who he was.
Yeah, I mean, it can't be easy. You go from being a completely functioning individual, independent, to being dependent. And so even if your cognition is decreasing a little bit, you're still aware to some point. And, it can be depressing for that individual, which, of course, is a bit of a hindrance as well. And that depression kind of transmit probably unintentionally to whoever the caregiver is, And then, of course, the caregiver probably has some degree of depression as well. But I'm sure we'll talk about that.
So let's talk. So the CDC lists caregivers as a public health priority, because right now they recognize that for every person, every one adult, you can identify at least 7 family members to assist with care, right? Yeah. However, because we have an aging population. Because we have an aging population, by 2030, they said that one adult will only have at least 4 identifiable, maybe. So, like playing spades, that's like 4 possibles.
Okay.
For caregiving.
Gotcha.
And then when you have rising healthcare costs, and you have rising inflation, which causes rising housing, if an individual is taking care of their home and their family, can they really take on the cost and the burden of taking care of another family member?
Because there is a cost to it.
There is a cost to it.
Not free.
And then also in Georgia, 40% of adults providing unpaid care for a family member, they're doing it for at least 2 years. And then of that 40%, let me make sure at least 1 in 4 of those individuals are caring not only for that adult family member, but also for a child and grandchild.
Wow.
It is. So I am honored because today we have on, like I said, my first guest. I probably am stumbling because I'm nervous, but I have on from Savannah, Georgia. I have on Miss Tamika Blanchard. So Tamika, how did we know each other?
My roommate, we're in class together.
I I was trying to jog in my memory. How do we know each other? But recently, we follow, how you have your friends that you've known through life. We follow each other on Facebook. And so I was looking and I seen that she's taking care of her father. And then I happened to stroll on TikTok and I see she has a TikTok for him. It's Package Shop Pop, correct?
And hence the name. My dad worked in a package shop in Savannah. He's very popular and he worked in a package shop for like 57 years. So the name was fitting. And Pop is the name that everybody calls him. So package shop Pop.
So, and what I realized he has some type of Alzheimer or dementia episode going on. And but she has 60,000 followers on TikTok.
That's impressive.
But the thing what I notice is she addresses her TikTok and correct me if I'm wrong, basically identifying the struggles that she endures having to take care of a loved one. So that's what we want to focus on today, the caregiver burden. All right. So thank you for coming on with us.
And actually, like you said, there are different types of Alzheimer's dementia. He actually has vascular. He had a stroke. So as far as some people that have dementia, their family members, sometimes it leads up to like memory loss, losing stuff, not remembering stuff. His was an overnight thing for us. Like I said, my dad worked in a liquor store for 50 plus years. And so back in 2000, he started thinking of retiring, hanging up the cleats. It's time to give it up or whatever. And like in November of 2000, my dad was the type, he was in good health, didn't go to the doctor. He would do a lot of natural stuff or whatever. He prided himself on natural stuff. He walk around Forsyth Park 2 times a day. I mean, he was healthy as far as, and that's another thing. A lot of Black men think they're healthy because they don't go to the doctor. But in actuality, back to what I was saying, in November, he called me one day. And this is a man who did his job. I can count on 2 hands the amount of time since I've been alive that he's called out. And that's because either it was a graduation where he put his job before a lot of stuff. So he called me in November and was like, guess where I've been at all day? And I'm like, where? In the emergency room. What happened to you? So apparently that day he felt some type of way where he actually took himself to the hospital. He was in the hospital the whole day. He told me, well, they gave me a tune-up, I'm fine. So then I knew his blood pressure was high. Then I knew, let me make some kind of arrangements to make him an appointment or whatever. So at the time I did, because he needed a follow-up. So I made him an appointment with my doctor, which he went to the doctor in December, which would have been the 30 days out. And the doctor put him on a blood pressure medicine. Well, when you go to a doctor and you get on a medicine or something, and they want to see you in 30 more days. So he went January the 9th of 2021 for his follow-up. Everything was fine. They did lab work, and he was scheduled to go again February the 9th. Well, for years, our routine is, even as an adult, I go to my dad's house every Sunday. And I live in Hinesville. He lives in Savannah, whatever. And still like clockwork, we would go every Sunday. Well, he had retired January 15th of 2021. He retired a couple of days after going to the doctor. And I spoke with him maybe on the 23rd. I was in town or whatever. And I spoke with him and I said, well, since you've been off for 2 weeks, what have you been doing? Catching up on some rest, which if I would have went to his house on a Sunday and he didn't answer, I would have thought because of that statement, oh, he's just in there asleep. We'll see him next week. But I got a call from my dad's girlfriend. Like I said, he retired on the 15th. I got a call from his girlfriend on that Saturday of the 28th or something. And she was like, when was the last time you saw your dad? And I'm like, I talked to him on Tuesday. So I could hear in her voice, she was kind of concerned. So I immediately jumped in the car, came to Savannah. And she didn't have a key. I left my key. So when I went through the window, there he was in the house on the floor. I was trying to get him up. He had already like urinated on himself or whatever, used the bathroom on himself, and I could tell he'd been down there. Where from speaking to people, his friends, the last time someone spoke to him was on that Wednesday. So he was in the house for 3 days. Like he had a stroke. He was in the house for 3 days. Thank God he was still alive. Well, immediately he lost his vision and the dementia kicked in. It wasn't like a right away thing because he could still remember my name, but he had the cognitive issues right away. Once they did the MRI and the CAT scans and everything, they saw that he had had a stroke. So I'm, like I said, I'm long-winded, so I'm almost getting lost at what I was supposed to say. But like, oh, it was really for us. It wasn't like it was an overnight thing. I mean, he had a stroke and he was in the hospital maybe for like probably like 30 days after that. And from the hospital, he went to a rehab and he was there for like 2 weeks. And then that's when I brought him home.
You've answered a couple of questions that I had next in reference that he was living independently. He really didn't have a primary care doctor up until that December of 2021 of 2020, and you did the what most physicians are most emergent follow-ups acts that you do. You had a follow-up for him 30 days later, and he was being compliant with the meds, but he just had the event.
Exactly.
How did that affect you? Like, were you prepared? Um, were you prepared, like, for financially, mentally, to take on this endeavor? Like, was there work lost or?
Actually, well, in January of 2020, I started my own career. I started my own business of an insurance. I was working from home, working for myself. The pandemic, I was working at home. So fortunately, I was fortunate to work from home. And another thing with people not mind doing Zooms or calls and not being in people's homes as an insurance, selling insurance, a Medicare specialist, an advisor, that wasn't any problem. So as far as bringing him in my home, I personally, I wasn't prepared for it. I mean, I have to give everything to my boyfriend, my backbone, because he was the one like, your dad is going to have to come home with us. Like my dad lived on his own, so we didn't know the outcome. Like I said, he was in the hospital for 30 days, and then we did the rehab. And during the rehab, he could not walk. That's another thing. The stroke, he couldn't walk. I don't know if it was from him being just laying down for so long, or if that took something away from him, but he couldn't walk either. So at the time when he was in the rehab, we went and tried to adjust as any older person. I mean, my dad's house, he was a hoarder. So, I mean, we went and tried to like at least make the house presentable. Although he entertained every Sunday, his friends came over, but he was a hoarder. So we tried to make the house presentable. But once I was going during the hospital hours, I was there every day from 11 to 7, which was the hours at the time. And at the rehab, I think it was the same thing or whatever, but I was there every day, every single day. When he came home, when it was time to discharge him, the options was either he's going to have to go in a nursing facility or he would have to come home with me or whatever. So after speaking with my boyfriend, he was like, well, he's going to have to come with us. I personally was mentally not prepared. I thought, well, I'm just going to have to put him in a nursing facility and I'll just go there every day. We brought him home. Thank God, like you say, financially, that wasn't a problem. It wasn't a burden on us or whatever. Um, I'm sorry. I kind of lost a train of thought. But like financially, it was fine. It was just the fact of mentally being prepared to deal with somebody who was not able to do anything for themselves. And also hard for me seeing my dad, who's been independent all his life, not being able to do anything on his own anymore.
So, how have you learned to adjust? Because I see you have your team. I see that your son is like a lifesaver. And how have you learned? There's still a balance. Because I see, I'm going to tell you, I kind of live through you when as I watch you, I see, because you did the dance that he did across the floor. But I'm sure he has his milestones of finishing high schools and things that you want to participate in. How do you balance that?
That was one thing. My son, he played basketball. He's been in sports since he's been a child, and basketball was his specialty sport. He actually initially, well, I have to give a little more detail or whatever. So initially, my son being a 13-year old, my son being a 16-year-old, smelling himself, wanting to do what he wants to do. At the same time that my dad was supposed to get out of rehab, him and my boyfriend bumped heads. So it was one of those things, time to go to your dad. And it was my son with his dad, my dad came in the house. So my son and my dad has been close. Like I said, I go to his house every Sunday. So he's been involved with him forever. So by him being out of the house, And that's when I started recording, kind of to show him little stuff or whatever. So he wasn't around him for maybe, he was around him, like we would go get him and come on the weekends, but being around him 24/7, initially he wasn't around him for a couple of months or whatever at the beginning, to see the worst part of it. It was me and my boyfriend, which he's ex-military. So he made sure that my dad, like, okay, let's come on, you're gonna walk, you're gonna eat on your own, you're gonna do this, you're gonna do that. We as far as the health healthcare is in Georgia, it's not, and I'm not gonna say it's not bad because I'm an insurance agent, I sell insurance, but you don't get, I mean, you have to have money. If you don't have a lot of money, you're not going to get the healthcare that you need. And
Well,
so they offered rehab at the house, but it was only 2 weeks or something like that. And so,
I have a aunt. Well, my dad in the past, unfortunately, he passed in 2008. But my aunt, she also had a stroke, and it's amazing to see how individuals, if they make just a little too much money, how many services are cut off of. And I did speak to her early on, if I could bring up, because she was, I'm not gonna say she was totally like your fault, because she had her cognition, but yes, she was going to work to do inventory at a job that she had been on since 1970 something, and she suffered an acute stroke, pulled over in the Denny's parking lot. Um, but to get the adequate services for her, it was an ordeal, you know. And those are some things that we want to cover throughout our series, to just talk about, like Medicaid, Medicare, but that's right now. We just want to talk about the burden. We were able. She had a home. She had to go and live in a income based,
sort of independent kind of living.
independent, but she had to relearn to use a side that she hadn't used before. So that right there, I can definitely relate to, because you have to navigate the system completely blinded, you know. And was were there and I'm not trying to fault the social workers in the hospitals, but I'm sure that they had so many patients, they could not just sit down and give you the step by step of what they really were trying to focus on is, where is he going once he leaves once he leaves rehab, where is he going, and once we have identified a stable place, once he leaves here, the follow up after that is basically,
It's largely on the family.
it's mainly on the
And you have to kind
family
of
of.
feel your way out as you go.
Correct.
God, like I said, for that 2 weeks that we did get, they came in 3 times a week, and we just kind of followed along with what the actual PT, the physical therapist, did with him. And we mainly had to do it because by him being so independent, my dad could not walk, but in his mind, he thought he could. So I suffered. I'm about to say, I'm sorry, but we spent many days in the ER because if he would fall, I didn't know if he hit his head or not. I just knew he fell. So we had a camera, and I fell down the stairs a lot of nights because it would beep and he's up and I'm trying to get to him, but he would never stay in the bed. We tried to restrain him, which that didn't work. I mean, he would not sleep. He would not sleep for days, which he does that now, but it was because he was trying to get out of the restraints, which you can't blame him, but we tried to restrain him for his safety. But as far as my son, because to me personally, it had gotten to the point, like I said, we were together, but we weren't married. So I felt like he was fine with it. He's still a great help with my dad to this day. But I know me personally, I would have a problem kind of, because my dad was to the point where he was tearing up a lot of stuff in the house. He was urinating all over everything. And I just felt like if I was in my own space, in my own place, then it'll be a little easier for me as far as the burden, because that's when the depression came in, because I felt that part like, here he is, this man taking care of my dad, my son, and me, like three, and so I felt like I needed to put him in a different environment. So we moved out, and my son, that's when my son, he missed his granddad so much from not seeing, but he didn't realize how severe it was as well until he got in the house with him. And he just, I mean, he's compassionate by nature. I mean, as you can see on the videos, and thank God for it, because he deals a lot with him. He knows that sometimes it's a burden on me, and he's like, Mom, you can go lay down, I got him. And it's fun to him because he said, I got a little big brother, so it's kind of fun to him, but at the same time it is a burden sometimes, because like I said, he used to play basketball and he just was like, I'm just not gonna play this year, I'll just help you with my granddad or whatever. And so that's, I mean, it is a burden on a family. I mean,
Yeah.
So everyone has basically made sacrifices to make, and I don't think individuals realize those
Yeah, the toll it takes
the
on
toll it takes
individuals.
to take care of a loved one who has suffered a health event such as your father.
if I had to work, if I still had to go to a 9 to 5, then I
Right.
would not be able to. And there's a lot of people who are not fortunate enough to actually work from home and make a living to pay their bills. I mean, so yes, it wouldn't work for everybody. And it's not because they don't want to do it, it's just because they can't financially do it.
Circumstances do play a big role. It's just kind of happenstance. You're fortunate enough to, like you say, have your own business and be able to work from home, but a lot of people don't. And you can say have the 9 to 5, and then there's finding adult daycare and
Right.
finding caregivers, and like you say, paying for all that is costly. So what do you do at that point? What kind of assistance is out there? How do you find it? What resources do you have?
You began recording on TikTok, right? And I think when I talked to you privately, you said that you basically just Google search help, correct? And so, and that's still in a pending stage for you. So currently, right now, you are still enduring all the burden solely between you and your son.
Yes, like you said earlier when you said about your aunt, as far as the resources, if you make a penny more than a certain amount in Georgia, they're not going to help you with anything. And I mean, just as far as working on the healthcare side, Medicare, I knew that. But as far as like trying to get him the assistance or the help or something for a care giver and like respite help, they have that, but because of COVID, like everything is blamed on COVID because of the pandemic. So we're not doing it in this state. We're not doing it in this area right now because of the pandemic. So that was, I would get that a lot, or either we don't have enough people working that couldn't do. So I just went on a Google search because as far as like my clients, myself, I do a lot of stuff for them. I don't mind because people are elderly and they don't, but from right now I get it from the consumer side and as the professional side. So trying to call and get help for my dad, it just wasn't there. He was making $2 more than the amount that he needed to make. And in the state of Georgia, if you're blind, you can get, it's ways around to get Medicaid when you're blind. Like his stroke, it took away his sight. I don't know if I said that too, but he is considered blind or whatever. So I was able to get like a partial Medicaid for him. And with that, we still have to pay. And I don't mind. I mean, he pays $808 a month just to have the partial Medicaid because he was making over the median amount. They only allow you to have a certain amount in Georgia for yourself if you're getting any kind of services. So in order to get that partial Medicaid, then that's when the other service came in as far as us getting someone to come in and help. But right now, like I said, nobody's not working, so we still don't have anybody.
But just imagine individuals who have to work that 9 to 5, they're on that limited income, taking in a household, another family member, they would not be able to afford that. They would not. And
It's like a cycle that you can't get out of. So if you can't afford to have it at home, which is probably the least expensive option, how do you afford to have them in a nursing home or some other, you know, caregiver place?
See, if a person is in a nursing home, the state actually takes over everything or whatever.
you started this TikTok. Did you imagine getting an audience of 60,000?
Oh, we did TikTok. Actually, it was my son. Mama, let's put Pop on TikTok because he said some things, and I'm because I try to gear my page towards not so much as making jokes and getting views based on crazy stuff that he does. some stuff we don't put, but we started recording little things he'll do or whatever. And when we first initially put him on there, I went on TikTok myself, and I would see people that had the same issues as him, and I saw, oh, this therapeutic. It was therapeutic for me, and then so I said, well, let me put him on TikTok. And the reason he went viral, it was basically not an issue that's dealing with the dementia. It was just something that he did, and so we picked up people from all different things, and like most of our TikTok people, we call them our TikTok family, because it's like, even though we have 60,000 viewers, we have like hundreds of them that we actually interact with. Like, we go on live. So a lot of people, when we go on live, they'll come in and we like having this big old family reunion, dinner table type conversation. And a lot of people inbox me or whatever. So we call it our TikTok family. And once we started it, we didn't expect to get so many followers. I mean, we were doing it mainly to help people out, to show people, like, because he has progress. He actually is at stage 6, but people wouldn't know that because he does still interact and everything. It's just the cognitive issues and the blindness. And so because we worked so well with him, like, as far as, even if I was to try to get him in a nursing facility right now, he wouldn't, his doctor won't write off on it, because, and that's another thing, his doctor wouldn't write off on home health because his vitals are perfect. His blood pressure is perfect. He's healthy. I mean, everything is perfect. Had I did it in the beginning, it would have been fine, but everything is perfect with him right now, except for the cognitive and the blindness. So that's another thing. Like, I can't get the things done that I needed because
Working in the emergency department and working in the hospital as long as I have, I've never judged a person. They'll be like, "Well, where's their daughter? Where's their family?" And I was like, "You do not know the dynamics, so therefore, I cannot make that judgment." Like, you and your father had a relationship. There are some families that do not have that relationship, and it may not be because the children are not, maybe that parent. So you can't make that judgment, and it's just, and sometimes families are working.
what that's what I was going to say. As far as me living the life and doing this right now, and some people may take it the wrong way, like, how can she say that when she's doing it? But I personally do not want this for my child. Like, as far as, I feel like it's very selfish for people, and this is being judgmental, but I really feel like it's very selfish for people not to have insurance policies where they have living benefits if something was to happen to them. Because I mean, I consider myself only child. I had a brother who he took his life years ago or whatever. So I'm the only person that my dad had. My dad had a girlfriend for 30 plus years. So I always thought if something happened with him, she was going to be the person, which that wasn't the case. Like, she, out of sight, out of mind, was one of those things. So as far as me, I don't know, because there are days when I'm just like, I may need to put him in a home. I can't do this anymore. And then there's the conscious in me saying, "This your dad. You can't do him like that." But I talk to my son all the time, and I tell him, if something was to happen to me, make sure you do A, B, C, and D, and don't stop your life because of mine. Because I look at it like, my dad is 71. He's lived his life. I want to live to be 71. It's a burden on a person taking care of somebody when all of your time and everything is involved for that person. You're being a caregiver, so you're not being able to fully take care of yourself because you're taking care of somebody else. I mean, and as bad as it sounds, like you say, people say, "Where are their family? Where is this?" I know nursing homes has the stigmatism of abusing people, but if you're around, your person is not going to get abused. And I mean, right now, like I say, I take care of my dad, and it's hard for me to say, like, advising somebody put your person in a nursing home when I'm taking care of him. But I, I would not regret it had I done it from the beginning, because I mean, it's hard.
I pass no judgment because I understand, because you mentioned it, had you done it in the beginning, because I don't think that people understand the impact of providing care for an older adult. That person has higher levels of depression and anxiety. That person has decreased physical health, decreased immune, compromised immune system. And and also, the statistics say they have an increase for early death. So you can't take care of somebody if you're not here to take care of somebody. And so, you say you provide insurance services. Is there a way for individuals to contact you if they need to learn more about insurance services and how to make sure that they are adequately covered, you know?
Yes, my agency is called Premiere 2020. I'm on Facebook and I'm on Instagram. Or they can email me at info@premiere2020.agency. Send me an email. But I mean, like I said, my clients, I will help them out 100%. Like if people need anything, any resources or how to get this, like maybe in the area that they're in, like I said, we don't have the help right now because there's not an agency in the Hinesville area to help him. But then in Savannah, there may be people that can help them. So if I could give them the info to where they can get the agency, to where they can get health care, I mean, home health, I don't mind doing any of that. So
I don't know how to thank you to me. I just went out on a whim. I said I'm going to reach out to her on Facebook, and I thank you because there are some things that people be like, "Oh, I'm gonna be there for." I'm the only child too. I'm gonna be there for my mama. I know I am, but I need to make sure that I have the right resources. She has a husband, but time is not guaranteed to anybody. We do not know the day or the hour, and to just be prepared and for individuals who are taking care of family members, to let them know that it is okay for the feelings that they have.
I feel like we haven't covered enough, but I mean,
I know, but when you're on limited time and you want people to, but I do thank you. I thank you.
Oh, I thank you.
have our platform, Pack and Shop Pop. So I'll make sure to put it black. Is it Black Health?
Black Health Perspective.
Okay, I make sure to put you guys out there too, or whatever. And thank you guys so much for considering me.
We appreciate it, and hopefully we can have you back too.
Okay. All right. Thank you.
Thank you so much.
Thank you for tuning in to the Black Health Perspective.